Hello friends, I am Abhishek Broni from Knowledge Gem and today we are back with another video on our channel. So let's get started. So the topic of today's video is Acute Encephalitis Syndrome, that is known as AES, or it is also known as Chamki fever in the Bihar local language. See, recently in the district Muzaffarpur of Bihar, 400 cases of AES were registered. More than 400 cases were registered, and out of that, 150 plus deaths have occurred so far. This syndrome is basically implemented in the case of children and young adults. See, what is AES? AES is basically a syndrome that affects the central nervous system, mostly in children or young adults. It hampers the neurological functions and results in mental delirium, mental disorientation, delirium, coma, or even death. See, in the case of Bihar, the deaths were not due to the acute encephalitis syndrome, but due to the prolonged hypoglycemia that was left untreated. What is hypoglycemia? Hypoglycemia is a situation in which the normal blood sugar level of a person goes way behind the normal blood sugar level of a person. See, these two conditions, the hypoglycemic encephalopathy and acute encephalitis syndrome, are basically different from each other. The major point of differences between the two are that in the case of encephalitis, the fever is started before the brain dysfunctions begins, and in the case of hypoglycemic encephalopathy, the fever is seen after the brain dysfunction begins. The major difference between the two is the density of white blood cells in the cerebrospinal fluid. In the case of encephalitis, the density of white blood cells is very large, which cause brain edema or inflammation in the brain, resulting in headache, convulsions, confusions, or coma. And in the case of encephalopathy, the white blood cells are normal. However, in the case of encephalitis, the blood sugar level is also normal, but in the case of hypoglycemic encephalopathy, the blood sugar is way beyond the required level. See, people are talking about a Lychee link between the deaths that are occurring in Bihar. See, in 2012 and 2013, our two-headed team headed by virologist Dr. T. Jacob Jones suspected and the next year confirmed a toxin present in Lychee, which is known as methylene psychopropyl glycine, that is MCPG, which is responsible for causing hypoglycemia in experimental animals. And this toxin is also present in Lychee. See, Lychee in itself is not the cause of acute encephalitis syndrome, but it is one of the factors. And it basically affects the malnourished children only. Why only malnourished children? Because in the malnourished children, the reserve glucose level, the blood glucose level, is way beyond the required level, and the blood sugar level is way beyond the required level. And in the case of when body has a natural tendency to correct the glucose level, after the glucose level are exhausted in the blood, the reserve glucose level, that is known as glycogen, is stored in the liver. The glycogen stored in the liver is converted into glucose. However, in the case of malnourished children, the glycogen level are seriously low in their liver. So the body turns to an alternative method of producing glucose, that is fatty acid oxidation. And in this fatty acid oxidation is stopped by the toxin present in Lychee, that is MCPG. See, why it affects only malnourished children? Because since their glucose level is very low, and what happens that after the pathway is blocked, the brain needs fuel supply to work. If glucose is not there, then brain will not work properly. And in the presence of MCPG, when the fatty acid oxidation is stopped in between, there is release of amino acids that are toxic to brain cells. So this is the reason why coma is also seen in the person suffering from acute encephalitis syndrome. See what is the status of AES in India. Alone in the year 2018, 10,485 cases of AES were registered, causing 632 deaths across 17 states. See, India records fatality rate of 6% in AES. However, in the case of children, it goes way beyond 25%, which is a very high rate. See, Japanese encephalitis is the common cause of the AES syndrome. The Union Health Ministry estimates that 5 to 35% cases that of AES are diagnosed are because of the Japanese encephalitis virus. However, the syndrome can also be caused by dengue, mumps, measles, scrub typhus, or a variety of other agents like bacteria, fungi, viruses, and Japanese encephalitis is common. However, in most of the cases, the causes remain clinically unidentified. See, I am not saying that the lychee alone is responsible for the deaths of the children in the Bihar's Muzaffarpur, but it is a combination of humidity, lack of rain, and heat wave that causes the problem more worse. See, in the case of malnourished children, as I have explained, that their blood sugar level is way below the required sugar level, and hence the syndrome affects these children only. In well-nourished children, as there is reserve glucose present, so the blood sugar level is always corrected by the liver. And see, lychee, a study was done in the year 2014 comparing Bihar's Muzaffarpur and Vietnam's Bac Giang province. The study found out that the children affected from AES and hypoglycemia in these regions have a history to visit the lychee orchards. See what these children did. These children ate unripe and rotten lychee, due to which their blood sugar level decreased significantly. So this was a reason why coma or even deaths are occurring in the state of Bihar. So this marks the end of the video. If you have liked watching the video, then please subscribe to the channel and hit the bell icon.